We're going to try to get a little closer to mic today here. Thank you. All set? Yes. Good afternoon. We're making some real progress in our fight against COVID-19 I want to talk about. So we've got some good news today on our path to our economic recovery and opening the state of Washington. I'm pleased to announce that 2 of our 8 regions that we've established under our Healthy Washington Roadmap to Recovery Plan are now eligible to enter the next phase, Phase 2. These regions are the Puget Sound region, that includes Snohomish, King, and Pierce County, and the West region, that includes Grays Harbor, Pacific, Lewis, and Thurston counties. These counties together represent about half of the state's population, and they now may begin to operate in Phase 2 beginning Monday. These regions that we're moving forward Monday are eligible in Phase 2 because today we're announcing some relatively simple changes to the Healthy Washington Roadmap to Recovery Plan. The 4 metrics by which we measure a region's readiness to move to Phase 2, those are the case rates, the hospital admissions, the ICU capacity, and the percentage of positive tests. They remain in place. But regions will now only need to meet 3 of those criteria, those metric, to be able to move forward to Phase 2. So the criteria for remaining in Phase 2 or going back to Phase 1, if there's backsliding, will not change. So good news, overall our case trends are declining and our hospital capacity is easing. This is good news. More than 500,000 Washingtonians have now had their first dose of the vaccine. This is good news. So we are comfortable making these changes and allowing some further reopening as these metrics suggest. We're also changing the time frame for studying these metrics to determine when a region moves forward to the next phase. Previously, that was a decision based on a 1 week's criteria. Now it'll be evaluated over a 2 weeks period to give us a little more stability in the system, a little more predictability. And I remind everyone there's no application process for this. This is done based on the numbers, the metrics. Now, when a region, just to remind folks, when a region moves to Phase 2, restaurants may have indoor dining up to 25% of capacity, as may indoor fitness centers. In Phase 2, sports competitions may resume with limited spectators, and wedding and funeral ceremonies can increase their capacities above current limits. And you can find what phase of region you're in and how your local metrics work are progressing by going to the Department of Health website, doh.wa.gov. By the way, on the competitive and the athletic part, I should clarify that there's specific rules for a school-based competition. What I just talked about has to do with non-school-based competition. So we certainly like our progress we've recently made bringing down COVID activity. And so these are some promising signs that we're heading in the right direction. The good news is that the R0 number, this is the number that the epidemiologists use to determine how many people we infect. We hope now is below 1 in both eastern and western Washington. But the bad news is that this trend is in a precarious spot. It's in a high level to start with. So if we relax too much, we could be back into the horrific days of exponential growth. So we've got more work to do. We've got more diligence we need to show. We've got more persistence we need to demonstrate. Here's another good news. This morning I went to Clark County and visited one of our new mass vaccination sites at Ridgefield in the county fairgrounds. And I was really impressed by the work that's going on there. There's been such a great consortium of multiple organizations. The National Guard, the folks who are doing both vaccinations and logistical work, Safeway, the fairgrounds folks, other local communities are pitching in, UFCW. And this is working really well. They've already vaccinated a couple days, 700 people a day. In some of our other sites, they're up to 1,000 a day. All combined, these have done just under 4,000 a day in the last couple of days per day. We've also have the National Guard that are doing mobile clinics. So we want to be able to get the people who might have difficulty getting into a site. We go out to them, and the National Guard went out to Panorama Point yesterday and did, I think, about 570 vaccinations right where people live. And we intend to continue that. So our vaccination rates are going up dramatically. We were at about 13,000 a day just a week or 10 days ago. We did just under 40,000 a day this weekend, Saturday and Sunday. And so we're making really rapid progress on our capacity. There's been now about 545,000 doses that have been administered, and we want to see these trends continued. I want to thank everybody for their diligence in growing this vaccination capacity. Pharmacies are pitching in now. Pharmacies are using their appointment system, which work well. And I just want to thank everybody who has stood up this new capacity. Now, we've got to recognize a reality, though. Right now, we've got a lot more people that would like the vaccine than doses exist to be available. To put this in perspective, we've got about 1.7 million Washingtonians who today could be eligible for the vaccine, 1.7 million. But we're only getting just a bit over 100,000 a day from the federal government. So the limiting factor right now is the amount of doses that we can get from the federal government. And we really look forward to when those go up. We're very pleased that President Biden will be ordering hundreds of millions of additional doses that previously were not contracted for. And we're very happy that our doses have gone up 16%. But if you do the math, a lot of folks will not have access because we've got 1.7 million people who need it, and we're only getting 100,000 a week. So we know this. There are days ahead where we're going to have to grit our teeth and do everything we can to accelerate this rate of dosage production. But I know we will get through this. We have sacrificed too much to turn back now. And I know something about Washingtonians. Yes, there's cause for frustration. But I know Washingtonians are strong, resilient, persistent, and we are going to get through this together. And while we're waiting for our turn for these vaccines, the good news is we are not helpless. We are in this battle. And we have tools right now, even if I don't have the vaccine today, to use to protect myself and my family. And that's a mask, it's social distancing, it's being careful. We have these weapons available today. And we're going to bring the big gun, which is the vaccine, but we got to use everything we can. So in the days to come, we're still going to have to be really careful. And by the way, one of our favorite events, of course, is Super Bowl coming up. We really need to be careful during the Super Bowl. We love our Super Bowl parties. But this year, I hope people can do it safely, meaning virtually as much as they can. We will not allow the virus to win the Super Bowl. We ought to win the Super Bowl, which means to keep people from being infected. So I hope people will keep that in mind in the next week and a half. And I hope people will keep their eye on the ball to get this vaccine going, in which they are. With that, I have Lacey Fehrenbach and also Nick Struley of our office, our external affairs person. They'll stand for questions, and I'd be happy to as well.
Who have gotten their first dose of the vaccine but were told they couldn't make an appointment for their second dose, and they're running into numerous roadblocks trying to ensure they can get an appointment somewhere that offers a vaccine from the same manufacturer. So what's being done to ensure people are able to get that second dose within the established time frame?
Lacey, do you want to talk about that, or Nick? One or both?
Thanks for the question, Rachel. So we are working here at the Department of Health and with our providers to make the customer experience for vaccines a more seamless, customer-friendly process. That includes getting your first dose, and there is a lot of effort and energy around getting the many people eligible in 1B1, their first dose of vaccine, as well as their second dose. Some providers are able to book their appointments several weeks out. Others do it closer to the date. And so, that could be through a recall system where they will send you a text or email. It could be also through the phase finder system or otherwise. So we encourage, whether you are working on your first dose or second dose, please be patient. We know that Washingtonians are eager to get vaccinated. We want people to get vaccinated as quickly as possible. With the supply chain limited, the providers and we are facing these challenges with overwhelm of registration systems compared to the supply of vaccine that is coming in. And so it's taking some extra tries, both on the provider part and on the public's part.
And if I could just add briefly to what Lacey mentioned, which I think is spot on, and the governor's remarks as well, that a lot of the experience about booking your second dose appointment is going to be dependent on the provider that you chose for your first dose. So a lot of our vaccine administrators do schedule people's second dose appointments at the very same time that they schedule their first dose appointment. So a lot of that is going to be left up to the individual provider that someone has selected for their vaccine.
I might add that we hope this will improve in the upcoming weeks, because the Biden administration has told us that we have doses now for 3 weeks. This is really important because up till now, we have not been able to give people predictability more than just a few days ahead of time as to what doses would be coming into the providers. So with this increased level of predictability, we hope that this will allow providers to be a little more confident in their scheduling moving forward.
Governor, two-part question. Since this is a two-phase plan and we're mostly talking about counties moving to phase 2, the region, do you envision this being the framework sort of then through the spring here? Or do you have a sense that if public health metrics improve and vaccinations go up in the next few months, that you might be able to add looser restrictions or create a new framework? And second question, we've had serious delays with some of your agencies on public records requests, including the Employment Security Department. In the Health Department, these are public agencies' decisions that affect people in real time, but disclosure of calendars and emails is often being delayed by months and months. Are you okay with that situation? And if not, what do you intend to do about beefing up their abilities to speed up public disclosure?
Well, as you know, we're really committed to transparency, and this is important in our administration. I just heard about this frustration actually a couple hours ago, and I'll look into it. We would want to find a way to give your organization, all organizations, as much information as we can on a timely basis. I am going to look into this. We don't want people to wait on months in these emergency situations. So I hope we can discuss improvements with you in the near future. Fortunately, I don't think my office, the governor's office, has had that difficulty, but we want all our agencies to be successful. So we'll have some more discussion with you about that. We want you to have information on a timely basis. The probabilities is going forward in the spring, anything is possible. We could have an extraordinary run of, good fortune, and the numbers continue to go down, and the vaccine, production goes up dramatically, and we accelerate our reopening. It's also possible that we remain in status quo, and it's also possible, that things go backwards. So the best way I can answer is, we hope we catch a break from Mother Nature. We hope that the production of vaccines will improve dramatically. We hope that people will be careful, as I've talked about, Super Bowl parties and otherwise, and hopefully those things are going to work out.
Next question comes from Drew with King 5.
Good afternoon, Governor. While this is some good news for a lot of folks, people, particularly on the east side of the state and the southwest part of the state, now have to wait at least 2 weeks before moving up. Why not go week to week? Why make folks wait at least another 2 weeks before they could potentially move to phase 2?
Well, so we can give them more predictability and even things out. It goes both ways too, right? So if you have a bad week, and if we just have a week's evaluation, that means you might have to go backwards just because of one bad week. So this works both ways. We thought a 2-week period is more realistic to give people a more stable way to look at what real trends are occurring. The issue of where these areas opened up, look, it was just the numbers. The numbers tell the tale. We have set the metrics, and the numbers have differentiated from region to region. So this is a bit on automatic pilot. The numbers will make a decision. Essentially, we will not. We obviously hope everybody can progress.
Yeah, my question is about the data on the roadmap to recovery dashboard. If you look at it right now, it has data updated as of January 22nd, but a couple of those metrics only include data complete through January 2nd or January 9th. And can you just provide an explanation for how these decisions are made on a weekly or now bi-weekly basis when the data is lagging to that extent, and if there are any kind of efforts to get that complete data sooner?
Well, I can tell you we're going to make decisions on the best data we have, and the most recent data we have. We can't do anything other than that. Lacey, do you want to talk about any changes in our data system?
Sure, and one thing I want to clarify is that the public-facing dashboard is going to be updated while we're on this press conference, probably around 3 o'clock. The governor did show the slide that shows what will get posted at that time. So what the reporter just mentioned are metrics that were completed for last week. There is variability in the timeframes and the completeness of data. It's really important on each of these metrics that we're measuring either the 7-day or 14-day period that is most recent for the specific metric. These metrics come from different data sources and systems, and those systems have different degrees of timeliness, and that results in different timeframes. Our goal here is always to be using the data that are the most complete and recent for each of the 4 metrics.
It's hard to tell from looking at the graphic there, but how close are the other regions? Because they're going to be basically jealous. They're going to hit them right now. How close are they, say, in 2 weeks to be able to open and join the west and feed the center regions?
Well, you can look at the chart that we had up that shows where they stand as far as numbers. I think there's 1 or 2 that are fairly close, and others got some work to do. I don't know how to characterize it. But as far as, look, jealousy, the numbers make this decision. We don't. And so if regions improve and their numbers improve, they move forward. And so this is really determined by the citizens of these regions, of what they decide to do and how much they decide to be diligent and how much they decide, not to have people over for dinner and infect them and don't have big Super Bowl parties. And it's really kind of determined to some degree by the citizens of the regions. They have control over this. Now, the virus plays a role as well, too, but in the environment. But it's kind of up to us at this point on how much progress we show.
Hi, Governor. Hopefully you can hear me. This is going to kind of circle back to Keith's question a little bit on the counties that cannot do any sort of reopening or making it into phase 2 at this point. Down here in Clark County, I know that we're one of them, that we're not there yet. But you say it's up to the numbers, but also these decisions and restrictions have been made by you and the governor's office. So there are businesses down here who say they are suffering and they can't sustain this way, though especially in restaurants, spread is minimal. What do you say to them who are still being kept from reopening in any sort of capacity because of the numbers?
I'm saying that what we have done in Washington State has worked and is working. The kind of decisions that we have made to date have been proven by the evidence to be well justified both by science and experience. The kind of decisions we have made, difficult as they are, have saved thousands of lives. And what I say is, if we had not done the kind of things we have done, we may have had another 7,000 or 8,000 dead people in the state of Washington. And I stand by those decisions. I think saving 7,000 to 8,000 people is well worth our efforts in the state of Washington, is what I say. I also say that the difficulty of restaurant owners and gym owners has been profound. And the losses that they've suffered, the anxiety they've had is something I feel every day. And they're real, and we ought to respect and care for them. That's why I've freed up over $100 million to date to help them. And I'm confident the legislature will do millions of dollars more to assist these business people who have struggled because of the COVID pandemic. And what I would also say that with these new metrics, we have expanded dramatically. We have now allowed half the state to move forward. It is a significant event. So we'll watch your headlines to decide whether you're a glass half full or a glass half empty. But we think this is a really good day in the state of Washington moving forward in our state.
Next question comes from Jerry with the Everett Herald. Jerry, are you with us?
By the way, the numbers that I just cited to you, those don't come from me. They come from objective sources. The New York Times did a study that concluded that if other states had been as successful as the state of Washington, if they had done the things that we have done, painful as they are by restricting some of our activities, that about 220,000 people wouldn't have died nationwide. We are the 5th lowest infection rate, at least last time I checked, infection rate in the United States. We are a national leader in the effort against COVID. And when you're the national leader, I think that's something we should take pride in.
We'll move on to Laurel with the Spokane Review.
Hi, Governor. I have two questions. So in the past, when we've opened up, we've seen an increase in cases and hospitalizations. So I guess I'm wondering what exactly is different now. I know you mentioned vaccinations, but a lot of the people who will likely be out, such as essential workers or young people, haven't been vaccinated yet. So I'm wondering if you could talk a little bit about that. And then secondly, I just want to clarify, will the metrics still be updated every Friday and then just evaluated every other week, or will they not even be updated every other week?
Well, we will continue to evaluate them. Lacey, do you want to explain that process?
The metrics will be posted every 2 weeks. The other question, so yes, with increased mobility and people being out, it will be ever more important that we do the things that we know work to control the spread of COVID-19. Vaccines are an incredible life-saving tool and can help us slow the spread. Every person who's vaccinated, that is one less person susceptible. However, all of the rest of us have to really double down on wearing our masks, especially when we're indoors, but wearing our mask anytime we're around anyone from outside our household, washing our hands, watching our distance, and waiting for those gatherings. If we want to keep going forward on this journey to reopening our economy, we all have to work together to slow the spread of COVID. We too very much want to go forward to answer one of the questions earlier, but it's going to take us all doing our part to keep the disease levels down.
Yeah, if I may add something too, it's really important. Even after we have been vaccinated, it is important to continue to wear masks, in part to prevent transmissions. The science is not clear yet that having the vaccine actually prevents us from transmitting the disease. So even though we get a vaccine, we still have to be careful about how we act around our families and everyone else, and it still means we need to mask up, because we cannot be confident that the vaccine, it may save our life with 95% efficacy, which is an extraordinary miracle to have 90% efficacy to protect me when I get a vaccine. But the science is not clear yet that it prevents me from transmitting the disease. So all of us have to remain diligent. And the presence of the vaccine is a significant reason that we have taken this step today, because 89% of the fatalities are amongst the group that we are now vaccinating. So we've got a tremendous tool to wrap our protective arms around the people who otherwise could lose their lives. And that has enabled us to some degree to take this step. But we obviously have more work to do. And I kind of like to look at it like this. Look, we've been on we got into a lifeboat a year ago. We all got in the same lifeboat, and we've been rowing really, really hard under a hot sun. And like you see the island, that's your salvation. We're getting closer to it, but I would say we got to row harder now, not easier, because you know there's a temptation to give up when you get close. But we got to row harder now to make sure that we get there together.
Thank you, Governor. You talk a lot about right now, the numbers now being on autopilot when it comes to reopening and whether the regions can make those metrics or not. But it wasn't autopilot because you had to determine that we were meeting 3 instead of 4 metrics at this point. Otherwise, it looks like none of the regions were going to be able to move forward for the 4th week. So I wanted to ask what went into this decision of yours to change the metrics to allow for more reopening. Was it simply that no one could make it to phase 2, or did Senate Bill 5114 have anything to do with about it? Thank you.
Yeah, well, several things. Number one, we have the vaccine, which is now available. We've administered, 535,000 doses, and we're well on our way. We've doubled our vaccination rate in the last week to 10 days. The administration is going to be sending us more doses. So that is a very significant part of our thinking, that we're approaching a way to really save the most vulnerable amongst us in the next couple of months. Number two, we have had a quite significant drop in the cases and hospitalizations. And if you look, could you put the curve up again, please? If I can look at the epidemiological curve, if you look on the right side of the graph, it is quite a pronounced reduction that we are now enjoying, and that's significant in our thinking. And when we did this with the hope that this is going to continue so that more regions can get into phase 2, but we also built in a fail-safe mechanism in that if those numbers start to go up over a 2-week period, either on any 2 of the measures, that region will have to go back into phase 1. So we built in a fail-safe mechanism if these trends essentially were to start to reverse themselves. And that is important. We are aware of the variants that are out there that do cause us concern, and that's one of the reasons we built this safety barrier in there. And the third reason is, look, we are very empathetic with the businesses that are struggling right now, and that is something we've always thought about. And we think this is the right moment to take this step.
Next question comes from Nicole with Coyote Radio.
Hi again. I'm wondering, with the departure of EST Commissioner Susie Levine, and now with this unemployment bill passing the Senate, but getting criticism for not requiring EST to pay people faster, to respond to people's calls faster, we're hearing from people with Work in Washington especially who are very concerned that workers are still not getting help. And right now the unemployment dashboard is down, but at last count there were almost 40,000 people who were still waiting. And I've heard from many people who have been waiting for almost a year now, since last March. How are you going to ensure that people will get paid faster, especially now that there will be no employment security commissioner?
Well, Cammie is our interim director. I've spoken to her. We are continuing to build capacity into this system, and that effort is going to continue. And we are still pedaling as fast as possible to build the capacity of the system to adjudicate these cases. Now, some of those folks that have been waiting will ultimately not be eligible because, for one reason or another, they were not eligible. And many of those cases are an adjudication process that is quite complex at the moment. But we want to finish that adjudication as fast as humanly possible. In order to do that, the department is using new technology, training new people, building new capacity, and we're going to continue in that effort. Because those folks who are waiting, it's terrible anxiety and frustration to wait during that length of time. So we're going to, that effort will not be retarded at all by a change of leadership at the department. I'm very confident of that. And as time goes on, we'll share with you some of that additional capacity building activity. Yeah, if I may, too, I know people are frustrated by this situation. One would think that we just had a one-time event and that we should have just got over it by now. This is not a one-time event. We continue to have, in a sense, at least the same level of challenge for the department, or increasing amounts of challenge, because we have different people coming into the system. So it's not like there was just one load that the department had to lift. It is a continual load, and that's why we need to continue to build more capacity.
Next up is Carolyn with the South Seattle Emerald.
Hi, yes. So as you already mentioned, and as I think I mentioned in my question to you a couple days ago, there take potentially deadlier variants of the virus expect to become the dominant version of the virus in the entire U.S. by March, which means it's going to overtake the original virus that's been circulating for a year. And there are two more variants that appear to be of concern, one of which appears to be able to avoid antibodies, and the other of which appears to have a general resistance to the vaccine. If you want to save lives, why would you risk opening up even more when the future is so uncertain? Why not continue to financially assist struggling business people rather than risking more deaths?
Well, we believe that you have to make a decision based on science, reason, and we're bringing both of those to the table. And when we have a life ring to wrap around 9 out of 10 Washingtonians in the next couple of months, which we have, which is the vaccine, we believe this is a reasonable step. Now, let me share with you what I mean by that. About 9 out of 10 of the people who might lose their life because of this variant or the old-fashioned COVID, we now have the ability to protect 9 out of 10. These are people over the age of 65. And we today have a 95% effective way to save their lives. So when you talk about fatalities, we have a way to save these people in the next couple months. And when we've looked at the potential rate of increase, we believe, we hope, and there's a reason to believe, we're going to get those people vaccinated before this variant becomes dominant and before it would cause exponential growth. That is a reasonable prediction. It is not a certainty, but it is a reasonable way to think about this. We've talked to the Institute for Disease Modeling just a couple days ago about this, comparing our situation to where the variant has been in various other countries. So we've looked at this very carefully to look at the time where we can get people vaccinated who might die compared to when these variants could get here. And we're hopeful. Now here's the other thing. If these variants get here big time and we start experiencing exponential growth, you know, with the safety we've brought into this system, we'll go back into a safer zone in a heartbeat. So we have built in a way to cushion against that potential eventuality. That's the reason we're doing it.
We have time for 2 more questions. Next question comes from Casey with KREM.
Right, so first we had Safe Start Washington, then that was scrapped for this roadmap to recovery, and it's been, what, about a month of that plan that's already being modified here. So I guess my question is, why should people trust that this plan, this time, is really the right plan, the best plan?
It's the right plan today that we can do with the best science and data we have. It's based on real science. It's based on real experience. It's based on a rational prediction of where we are with potential future activity. And it is the best plan that we can fashion to fit the current circumstances and the needs of Washingtonians. That's what I can tell you. Is it fixed in absolute stone? Of course not. We've got to be willing to be flexible if there's giant changes in our circumstance. But one of the things that I think is good about this plan is it builds in that flexibility. This can go up if things get better. It can go backwards if things get worse. And it's pretty acutely sensitive to changes in those infection rates with scientifically valid data. You know, so I think they should be confident that this has happened because we do follow the data, and maybe, just maybe, we should have a little confidence in our state. as I've said, we're better than 45 other states. Maybe that should give us a little confidence that we're making good decisions. I don't think it's an accident that we've saved several thousand lives in our state. It's because we've made good decisions. And when I say we, I mean we. It means Washingtonians who've been wearing masks, Washingtonians who've been complying with some of our very difficult business closure rules, Washingtonians who've been innovative in schools on how to go back to school safely. This credit goes to Washingtonians.
For the final question, we're going to go back and try Jerry with the ever thrilled again.
Thank you for coming back. Sorry about the technology issues, Governor. The plan has 2 phases, and when you introduced it, you said there'll be more phases. And now that half the population is in phase 2, I believe in 2 weeks they could be eligible for phase 3. So what will be in phase 3, and when will we see it?
I can't tell you a date on that. We've not thought through that, so I don't have a prediction on that date. It'll be the right moment. It's the best I can tell you at the moment. We're pedaling pretty fast here right now. We just stood up 4 mass vaccination sites that in a matter of days are now vaccinating almost 4,000 Washingtonians a day. And we've got new hundreds of pharmacies in the game that we have organized. We have mobilization sites that are now mobile units with the National Guard. There's a lot of things going on in the state of Washington, and we're focusing on that work right now. Nope, want to thank everyone. Again, huge thank you to everybody who's helping on this. The National Guard, look, the Washington National Guard has rescued the nation's capital. It's protected the Olympia Capitol. It's in multiple sites now saving lives, vaccinating people. Boy, are we lucky. And we're lucky to have a vaccine. And we're real lucky to have strong people in our state that are going to get through this by recognizing that we're doing all we can to get them this vaccine as rapidly as possible. And with that type of courage and strength and a good vaccine, I'm confident we're going to get through this. Thanks a lot. Be safe.
Okay, great. Thanks, Aiden. Okay, see it. All right, Alan, just increasing my text size, because that's what I do. And I'll be ready to go here. Okay, so Nats on. By the time Mitch Haniger takes the field on opening day, it will have been over 600 days since he last played in the majors. He's been working his way back from injuries to his core and back. He battled through a couple of setbacks, but says all that did was increase his mental toughness. First track. By the time Mitch Haniger takes the field on opening day, it will have been over 600 days since he last played in the majors. He's been working his way back from injuries to his core and back. He battled through a couple of setbacks, but says all that did was increase his mental toughness. Second track. We're going to be a long one. Haniger has always said he enjoys putting in the work, especially if it will make him stronger. Haniger credits Austin Einhorn for introducing him to creative ways of strengthening his overall body, like engaging in his 300-pound sandbag gator wrestle. Okay. Second track. The road to recovery can be a long one. Haniger has always said he enjoys putting in the work, especially if it'll make him stronger. Haniger credits Austin Einhorn for introducing him to creative ways of strengthening his overall body, like engaging in this 300-pound sandbag gator wrestle. The SOT track, all that work has paid off. Haniger says he was finally back to feeling 100% healthy by the end of last year. Third track. All that work has paid off. Haniger said he was finally back to feeling 100% healthy by the end of last year. And that's and this is the last track. No matter how many hours of rehab he put in, Haniger made sure to keep up on his teammates and was impressed with their effort last season. 3, 2, 1. No matter how many hours of rehab he put in, Haniger made sure to keep up on his teammates and was impressed with their effort last season. Haniger made sure to keep up on his teammates. I'm going to do that one again. No matter how many hours of rehab he put in, Haniger made sure to keep up on his teammates. He was impressed with their effort last season. Okay, that's better. Okay, that's it. 4 tracks. I'll send you a script. Thanks, Aiden.